Hello everyone, I'm just going to talk about infection prevention and the importance of vaccine preventable infection. So if we move on to the next slide, just to talk about vaccine preventable infection. So the reason for that is it's one of a suite of measures that we use to reduce the risk of viral transmission in healthcare settings. And because there's many reasons for that transmission within our healthcare settings. And if we can control that through vaccination so that we're not bringing it into our settings, we're actually playing a central part in managing all aspects of the risk of viral infections. If we move on to the next slide.
Sorry, there's just a delay.
Yeah.
You want to?
Okay. So just to talk briefly about vaccine preventable illness. So there can be predictors of outcomes for all of us, but there are other predictors then that could impact particularly the cohort of people that we look after in our residential settings or that we may encounter in our community settings in primary care. So that could be then predictors could be the person's age, whether they're newborns or older persons, their general health status, do they have underlying conditions such as diabetes, are they a smoker, have they got comorbidities, and this can impact then the virulence as well of the infectious organism. And then also what can also impact then a prediction of outcome would be vaccination status. And then what we've all just come through, a pandemic of a newly emerging microorganism. So if we move on to the next slide. So just to go through what an outbreak definition is, because when we do experience then widespread infection in our community, they will go into outbreaks and they'll impact a lot of our services, particularly our residential settings. So it's generally defined as 2 or more cases of a respiratory infection with the same pathogen. So that can either be COVID, influenza or RSV, and this is confirmed either by a laboratory test or a near patient test carried out by a health professional. It can also be then an acute respiratory infectious outbreak, which is caused by respiratory pathogens other than influenza or COVID. And that's then 2 or more cases of the same symptoms. And it's the Department of Public Health that prioritised the investigation and reporting of outbreaks in our settings and the clinical interventions from public health. So these settings include then our hospitals, but for us predominantly in the community, it's our nursing homes, it's our community hospitals and long stay units. And the outbreak data that I'm going to present on the next few slides just focuses on those key groups and settings. So if we go to the next slide.
Yeah, sorry, there just appears to be a bit of a delay.
Yeah. So just to talk about our experience of respiratory viruses and our settings is that they can have a profound consequence. And if we go back to our recent experiences prior to the vaccination campaign, how those outbreaks were and the impact on our residential settings, and it can continue to have an impact today. The influenza virus can also cause severe illness to our residents. So what we're looking at here is week 40 from 2023 to our current week. And we can see the peak of the respiratory season for infectious outbreaks kind of starts and it peaks then around week 52, which is usually Christmas time. And we can see then that it peters out. But as you can also see from this slide is that actually respiratory infections are with us all of the times in our settings and in the community. So if we move on to the next slide, what the IPC role is in relation to the benefits of vaccination is that if we look at the continuation of respiratory infections circulating in our community, if we're vaccinated and boosted against these infections, it can play a really good role in reducing the risk of spread and also then of severe disease in our residential settings. And it also helps us then deliver care in a timely and appropriate manner to our service users. So if there's high levels of community transition and co-circulation of respiratory viruses, that increases the pressure on our healthcare system. And then for us as healthcare workers in context of our health and well-being, when there's pressure on the healthcare system, there's pressure on us then to be able to support further. If we move on to the next slide. So what we're doing is with vaccination, we're offering a protection that's for healthcare workers and that protects them then against influenza and COVID, even with the booster dosing. So it's not absolute, but it is essential to avoid that intense exposure during those times when there's pressures on the system to the greatest extent possible. So people that are vaccinated who become infected are expected to be less infectious, and the vaccination, while it doesn't eliminate the risk of transmission of flu or COVID from our settings, it does boost our immune response. So healthcare workers, just as a general rule in terms of protecting us, is not only that vaccine piece and the boosters, is to be aware of the protection that is afforded by a vaccination when you're looking after people who have then different types of infection. If we move on to the next slide. So vaccination can reduce that impact, particularly for a high proportion of our residents, and it can have a major impact then on reducing the viral infections that then circulate. So it's possible then to manage that risk within our settings and have less restrictions on the lives of our service users in our residential care. There is, however, a need then for continued vigilance to prevent infectious healthcare workers and other people from entering the facility. And it's important to ensure that people with symptoms of respiratory infection are detected promptly so that we can start our transmission-based precautions. If we go on to the next slide. So this is our bread and butter in terms of infection prevention and control. It's that application of our standard precautions at all of the times. So there are the interventions that I was talking about in the previous slide. So it's the combination of vaccination to protect against infection, and then also our continuous application of our standard precautions that will work towards reducing that risk of an infection circulating in our environments. And if we go on then to the next slide. So this is the slide then, just to say that this is the number of COVID and influenza and RSV that are circulating within our communities. And it's all based on the data that is inputted to the HPSC website. So these are all confirmed cases through laboratory testing. So it's not even the cases that are unconfirmed. So you can see that it's just there all of the time. And if we move on to the next slide. Is there a slide missing? So there was just in terms of occupancy for ICU. Maybe I skipped over.
Not in the deck I have, no.
No, that's okay. So just to talk about, when we talk about vaccination and how it can help us in the community, prior to the development of the vaccine for COVID, we would have always been concerned about the pressure on our health system and also the occupancy in our acute system and in our beds. So last week there was data issued from the HBSC website to say that there was only 2 cases of people with respiratory illness in ICU. So if we remember back to the days during the pandemic, those 300 beds that we watched the numbers on all of the time. So sometimes we wonder how is vaccination benefiting us? So if we can compare the occupancy of 300 beds to 2, it's just a really stark way of seeing, well, actually vaccination does help when we move on 3 years from the pandemic. So thank you for your time.